want to welcome everyone back on into the Just Start the Conversation podcast. It is brought to you by St. Luke's University Health Network. My name is Kevin Crockett. Very happy to once again be back with you hosting this thing called the Just Start the Conversation podcast. Amie, Alanson, Dundon, 19 episodes in now, right? We're off of that rookie contract. We're moving into things here a little bit. We've got some veteran episodes under our belt. How you doing today?
I'm doing good, Crockett. We certainly are rocking and rolling. We've got a lot of episodes under our belt. I'm really excited for this one. Thank you to our listeners that are staying along for the ride, and our new listeners. We're really excited for you to kind of get on board now, and it's been fun. I can't wait for the next 19.
I am very excited about our guest today, as well as we get ready to talk about the national shortage of social workers and professional counselors and what we can do about that. Joining us today is Christina Gigler, an assistant professor of practice and coordinator of the Lehigh Valley Master of Social Work program with Marywood University School of Social Work. Christina, thank you so much for joining us this morning.
Thank you for having me. This is very exciting.
We are very stoked to have you. So I feel like the best way to always, when we talk about just starting the conversation, is to give a brief overview of a little bit into the topic that we're talking about. And I think the simplest question and the easiest way to jump into this episode is the role of social workers and professional counselors, and just kind of a definition of what each of those things are. So, Amie, I'm going to go ahead and kickstart with you on this one. The role of social workers and professional counselors, and just kind of how you would define what they do.
I wish that was an easy answer. So there are social workers who do everything from inpatient medical work to working out in the communities, to working in private practice, to working in hospital networks. But basically, I think for what we're talking about in terms of clinical social workers and licensed professional counselors are clinical psychotherapists who will treat folks that come in for the need of treatment of a mental health either diagnosis or disorder, or just emotional dysregulation that people are trying to find a way to regulate. I don't know, Christina, if you have other thoughts on that.
I agree. And it's interesting when I think about the social work profession. I definitely think the clinical route, but because I've been a social worker for 33 years now, and I look at all the different things that I've done. Yeah, I've done the clinical, I've done the therapy, I've worked with individuals, families, groups, communities, but I've also done so much else. I've done the grant writing, I've done, leading organizations, supervising, doing administration. Now I'm in academia, teaching in a master's of social work program, leading the program, so it's, I look at social work as all encompassing, anytime I do a recruitment speech, or I meet with inquirers where and some come to us thinking, I don't know if I want to be a social worker or do I want to be a licensed professional counselor, and then I say, well, what do you want to do? And they're like, well, I don't know. Well, then if you don't know, probably social work, because if you want to just do clinical, that's a licensed professional counseling, I think is a great degree. I think that's your degree.
That's what I am.
So obviously I'm a little more biased because I'm a social worker.
Well, that's why the two of us are here, because I'm a little more biased from that. So what's the difference? I have a master's of science in counseling and human relations. I do not have a master's in social work. So that's how, my master's degree leads me to being a professional counselor, and then how a social work degree conversely would lead Christina to go the clinical social work route.
Right. So I do have a license. I am a licensed clinical social worker. And what that means is that I have practice experience, but I'm also, I'm able to do clinical counseling. I can, get reimbursement from insurance companies for funding from Medicaid. I can do diagnosing. So I could do a lot of this. We could do a lot of similar things. We had to do 3,000 hours of supervised practice under a licensed clinical social worker, but I think that's similar to your credential, same credential. We have to, ongoing, we also have to do continuing education credits. I have to do 30 every 2 years. We have similar licensing with the same licensing body. It's, the State Board of Professional Counseling and Social Workers. So some of that is, there's a lot of similarities in our professions.
There are.
I think from looking from the social work standpoint, we are very guided by our social work code of ethics. And it's interesting. Some of the licensed professional counselors I worked with, they say, well, we use your license, your ethics, because they're so encompassing.
Yeah.
Some of the pieces of the ethical principles that really guides the profession are based in areas like social justice, human rights, looking at the dignity of every single person, the worth of individuals, the worth of families, the worth of communities. So that is kind of the thread throughout the entire profession. We also really look at, looking at every single person in every community and what do they need to change? What do they need to grow? It's not like, I don't want to knock psychologists and psychiatrists, because I think there's definitely, we need them and we need more of them as well. The whole mental health profession is struggling. I know Crockett started with that in the beginning, saying how there is a shortage, and there is a critical shortage for all of these professions, whether it's the LPC, the LCSW, psychology, psychiatry. Social work is just a little bit different. We're really focused on looking at the strengths of each individual. We're looking at the interconnection between what is going on for them, maybe in the mental health realm, but what's also going on for them in the environment. And as a social worker, what can I do to maybe help with the environment so that the person can be helped? I'm still looking at all the mental health pieces. I'm still doing the therapy, but I'm taking it a little bit further. I'm looking at how can they feel better in the environment, in their situation, but also what do I need to do to help them manage the environment? Sometimes the environment has to change for somebody to get better. So then do I need to, do advocacy? Do I need to call, the state rep and try to figure out what I can do to help that, my client get better? So we take it a little bit further, and not a little bit above and beyond just the counseling relationship.
So, you guys are in lockstep over there, which is excellent. You mentioned how much you guys are interwoven in your professions. It brings me to the question, though. You mentioned, Christina, groups, individuals, communities, three kind of segmented spots there in terms of people. If I am a person who is understanding that perhaps I need to speak with a social worker, a professional counselor, a psychologist, a psychotherapist, you guys kind of named a lot of different mental health professionals, and a lot of similar things are interweaving them, again, to kind of use that word that you said. How do I know the difference between each and where I need to begin as a person who knows that perhaps I need to speak to one of these people? Where do I kind of know exactly where to maybe find my groove and all of that?
Yeah, certainly we have a long list of professionals that are ready, and willing and able to help with mental health issues. But you're right. Where do you start? I think I always say, if you're not sure what's going on, first talk to your primary care physician and get cleared medically to make sure that there's nothing going on with you medically that really could account for some of the things that are going on for you that are concerning.
I totally agree.
Yeah.
And we would do the same thing.
Yep. And then oftentimes, if your primary care doc may say, you know what, I can help you if we just want to try. Sometimes primary care docs are willing with a mild anxiety or mild depression to prescribe a med. But for the most part, they're a whole lot more comfortable, for the most part, referring you, if you need medication, to a psychiatrist. Psychiatrists are medical doctors, MDs or DOs, who have gone through the same medical school that your cardiologist went through, and then did their 4 years of residency in psychiatry. And they are able to diagnose and treat and prescribe with medication. Also, psychiatrists can perform things like ECT, TMS, some medical procedures that the field has that are known to help people with maybe refractory depression, or depression that hasn't been treated real well with meds alone, or meds and therapy alone. So psychiatrists are your prescribers, are your doctors. Then we have psychologists. Psychologists, I like to think of psychologists, they're your PsyDs or your PhDs. They've gone to school not for their medical doctorate, but they've gone to school for their, how do you say that in the academia world? For their,
I would say that they're studying the mind. They're looking at the human mind and behaviors of individuals. They're doing a lot of assessments. They're doing testing.
Yeah. So they're the ones that if you need to get testing for ADHD, or you need to get testing, IQ testing, or you need to get any sort of neuropsych testing or psychological testing at all, the psychologists are going to be your testers. Psychologists can't prescribe meds.
Correct.
So it's the only people that you can get psychiatric medications from are psychiatrists, family doctors, MDs or DOs, or nurse practitioners or physician's assistants who have been trained in psychiatry and psychiatric medicine. So psychologists are doing your testing. Sometimes psychologists do therapy. A lot of psychologists do therapy as well. And then if you want kind of one-on-one talk therapy or marriage counseling, or you have a child that you think you'd like to get some counseling to work through, maybe they're being bullied or there's just some issues they need to work through, that's where you have your licensed professional counselors, your licensed clinical social workers, who very often do the front line of the therapy work. And then maybe they may be the one, Christina or I would be the ones that would say, I think maybe we need to get you some testing. I really want to get some clarity on your diagnosis, or, and or I want to work with your guidance counselor and get your teacher to fill out an ADHD rating scale in the classroom. So we all kind of work together. Generally, if you're going to see a therapist, it's going to be an LCSW or an LPC.
Correct. I think the other piece I would add to that is sometimes working with all of these individuals is what somebody would need. A patient or a client might, like Amie was saying, they might need to do the counseling piece. They also might need the medication. They also might need some testing to determine what else is really going on, in the brain, and so the psychologists, because they're more geared towards the scientific pieces of it, as well as the psychiatrist, but the psychiatrist is really going towards the medication. What medication would be best for somebody who is struggling with anxiety or depression, or maybe a psychosis or something else? Whereas a social worker and a licensed professional counselor, they would be really looking at the individual and how do we help this individual, move forward and get better. The other pieces that I think, when I look at social work as a profession, sometimes a person might not go to their, family doctor or their medical person to get a referral. They may just need somebody to talk to and gain resources. So I'm looking at individuals who maybe a trauma happened, or they're dealing with a family crisis, or they have a child right now going through gender dysphoria, or a family member who just came out to them, regarding sexuality issues. A social worker might be the first person that they contact because they need resources, and they need support. They need to figure out, how do I manage this? How do I do a good job as a parent to help my child through these issues? So a social worker is, part of the training is really to look at resources and what would help that person. So they may be making referrals, or help them get set up with support services or groups, or, just resources on websites or in the community that would help that individual. So I think that's another area that, just to kind of dig in a little bit further, even issues with human rights, race issues that are going on in society today. The pandemic, these issues were always there, but I think the pandemic just pulled the Band-Aid off.
Oh, yeah.
And things are just wild right now. And there's so many individuals who need support and trauma, figuring out the loss and grief of so many things that have happened. So whether they go to a licensed professional counselor or a social worker, I think those are sometimes good places to start.
Mm-hmm. Absolutely. Yeah, I think you're right. I think, and Crockett and I were talking about that before we went on the air today, just about the pandemic, right?
Yeah, for sure. And I think, as we're having a topic about the national shortage of social workers and professional counselors and what to do about it, I think it's an incredible thing, to use your phrase there, Christina, rip the Band-Aid off, because I'm sure there were a lot of people that were maybe holding in a lot more even before the pandemic. And then you had the pandemic happen, and people who were dealing with anxiety or depression or whatever the case may be, all of a sudden started making calls to professionals like yourselves, which I'm sure is a wonderful thing, until the inundation, maybe perhaps, of people making phone calls led to a sudden realization that there possibly is a shortage of social workers or professional counselors. So can we just jump into a little bit of what the role the pandemic played in particular for people like yourselves, as you did start to see an uptick in calls, and maybe even the pros and cons? Like I said, maybe you are now dealing with a shortage in these positions, but it's incredibly positive thing that there's people who want to talk to professionals and get the help that they can. So, Christina, I'll go ahead and start with you on that. Just kind of the role the pandemic played for people in your position and Amie's position, and kind of how we can kind of look at the pros and cons of all that and continue to move forward past that stretch of time.
I think what has happened is there's just such an increased demand for mental health services. In the wake of the pandemic that exposed so many injustices, oppression, healthcare disparities, that just, I think it made people more aware, of what they needed and what they weren't getting. So I think that's part of it. And I think at the same time, just trauma in general, loss and grief issues, and just the political nature of the pandemic and what that did to individuals and families. There's so much mistrust. What news sources can they trust? What news sources are telling the truth? So I think some of that really affected individuals. There's this paranoia out there. I mean, I see it in my own, with my own family and friends, just the paranoia. I went to an event on Saturday evening, and an individual asked me, like, well, what news can I trust? Who do you go to for resources? Because I'm struggling, with mental health issues, but I don't know where to go for help. And I'm like, come on, you could have called me. I can set you up. I can give you a referral to somebody, but his point was, I don't know who to trust. And I don't believe anybody. I don't believe that the pandemic really started, however it started. I don't believe in us needing to be vaccinated, but I'm afraid not to be vaccinated. So there's still this, and this is somebody who I, thought was, very intelligent and should know the resources and where to go for information, but the mistrust is there. And I think it just pointed out to me. So you have somebody like that, but then what if you have somebody who doesn't have enough food to eat? They're living in poverty. Maybe they don't even have capacity to watch the news. How are they getting the information? So I think the pandemic, it's no matter where you are, in society right now, whatever life you're living, you have been affected. And in my life, that's never happened.
No.
So the stressors that brought about in every individual, the anxiety, your close family member is still afraid to be out in groups, with individuals indoors, or the whole mask issue. It's bringing out a lot of fear, misunderstanding. And so it's concerning. And at the same time, the workforce is aging. So we're seeing social workers, licensed counselors, we're seeing psychologists, psychiatrists, they're retiring.
That's what I was just going to say. I think the pandemic really has pushed those of us that have been in this profession for 20, 30, 40 years to age pretty quick.
Yes.
And we're seeing the new generation of therapists kind of wanting different parameters from their career in terms of working from home, or things are set up very differently for the new generation of workers. And I'm old school. I'm a firm believer in face-to-face therapy. I think it works better than virtual therapy. I don't think that virtual therapy is bad. I think it's absolutely progress, and it's a good thing. I do think that there are certain people for whom in-person psychotherapy is a better option, depending on diagnosis or life circumstances. So there's navigating that, and which therapists are virtual and which are in person. And for my issues, is it better for me to be in person or virtual, or some sort of hybrid of that? And if I don't trust therapists to begin with, because I'm not really sure, is my information confidential? Who are they going to tell? And by the way, everything's confidential, and we're not going to tell anybody. We are the best secret keepers on the planet.
Absolutely. Absolutely.
Morning show DJs are not, by the way, just to let everybody know that. We are not good secret keepers. Yes.
Yeah. So I think that the pandemic changed a whole lot about the way the world works, and the way that young therapists versus us older dogs, and I'm going to put myself in that category, we're there together, the way that we handle clients and needs. And trying to gel the new with the old and come up with a system that works well for everybody. And I think we've done a pretty nice job. There's I think one of the numbers that I read recently was, we're encroaching 45 million people diagnosed with anxiety.
Wow.
That wasn't the number before pandemic.
Correct.
So it's great that people are getting out there, and stigma is maybe starting to, reduce a little bit, and we're talking about it more, and it's becoming certainly more socially acceptable to have a therapist and talk about anxiety, depression, bipolar disorder, what have you. But the numbers are rising, and the numbers of folks going into the world of psychotherapy, social work therapy have not been rising.
No, they haven't. And the scary part in that is that the Bureau of Labor Statistics is projecting that the social work profession is going to grow. The need is going to grow 13% from 2020 to 2033, which is faster than the average of any other occupation.
Wow.
So the needs are out there. There is right now, according to the Bureau of Labor Statistics, there are 713,000 social workers employed in the United States. And so project that 13%.
Mm-hmm.
We can't meet the needs right now
Right.
for the individuals out there who need services. So my fear is that, hospitals, outpatient clinics, social service agencies, government, any local agencies, educational services, schools, universities. I mean, this is a huge impact when you look at all that infrastructure. So people who need individual family services, child services, parenting services, they're not going to get the help that they need, mental health services. So it's critical right now. We're seeing that in other professions too, but the rate is higher in social work, which I think is interesting. I know the Morning Call locally just did a huge piece on the need for more healthcare workers, medical doctors, nurses. But right in there, I kept waiting to see social work, but I thought, wow, they want to hire social workers, but that should have been in there, and that was missing, because that is an increased need that it's kind of at a desperate standpoint, so even trying to get people into MSW programs, though, and maybe this is going to be the next topic, but there's not a lot of people interested, or they feel that they don't have the bandwidth to do it because we're also dealing with our own issues.
Right.
We are also have been affected by the pandemic.
Right.
So now how do you want me to take care of myself, but now you also want me to take care of other people? And then the salaries aren't there. Or maybe I want to work from home, but I can't. Or I only want to work out of the home because I have other responsibilities at home that won't allow me to work. So there's a lot of things up, in the air right now, which is concerning.
Mm-hmm.
Yeah, we're going to stay right there. Christina, to your point, Amie, I think the quote you used was this new generation of workers. So as we are trying to maybe encourage people to address the national shortage of social workers and professional counselors and psychotherapists and psychologists, Christina, to your point, you kind of said, well, how are we going to kind of bring these people in? What can we do to try to encourage people? You mentioned salary, you mentioned working from home. A lot of those things, again, the obvious one from the pandemic, working from home, obviously a key component for a lot of people out there, knowing, you guys work in the mental health business. Certainly, what the positives of being able to work from home if you have a family or other responsibilities and doing all those sorts of things. So, Amie, I'm going to kind of come to you with the point that Christina just made of just how can we encourage people to get into MSW programs and encourage them to try to take on this growing need. I mean, certainly those statistics were fascinating that you shared, Christina, about going up to 2033. What would you say to someone who is maybe thinking about a professional career similar to yours, and how would you encourage them to want to take that on and get that education and try to be the next one in line?
So I do think that we're starting to see salaries shift a little bit, and in terms of being compensated adequately. Pre-pandemic, that was not the case. I do think that was something the pandemic did do for us, was have people in higher positions think, oh yeah, we these guys are worth a whole lot more money than we were giving them credit for. So that's starting to help. And so I would say don't let the salary thing deter you, because I think people say, oh well, social workers, you don't make any money being a social worker. Well, I don't know that that's necessarily the case anymore. I think that's changing. I also think, just being very candid, I don't know of a better profession in terms of, if you have the heart where you want to help other people and you want to be able to make an impact very quickly. Um, this is a very rewarding career. Um, whether you're working in an HIV clinic, or whether you're working in private practice, or whether you're working in a hospital and healthcare system, you get to help people every day, all day. And that's hero status. I mean, the things that I've seen my colleagues do forever, but especially during the pandemic, and then beyond, it's super rewarding. And it's kind of a brotherhood and a sisterhood, right? I've known Christina for years, but this is the first day we're meeting. But I feel like we've met before.
I
It's
agree.
just, you all know each other. It's a very tight knit community. You could go to this person if you needed something. It's we take care of each other.
I agree. I think there's so many benefits to the profession. I can't imagine ever doing anything different. For 33 years, the variety of jobs that I've had, the rewards that I've seen with, when I help somebody and they actually get better and they're thriving. I look at some of the hardest cases I've worked with, individuals who, had a lot of suicide behaviors or thought patterns, or just severe psychosis. And just through our work together, they're out there, they're working. Some of them as social workers now, or some of them, as elementary school teachers. And it's so rewarding to see that. Even now in academia, seeing the students change, when they come in to what, we just graduated 67 students this weekend who are out there as MSW social workers now. And I think, oh my goodness, thank goodness that they're out there helping. And but I see the growth in them. It's such a rewarding profession for everything that Amie said. I also think I think it's a secret of a profession. Sometimes people don't really know what we do.
That's true.
They like, well, what does a social worker do? I'm like, you could do anything. I look at, you can work in a hospital, you can work in a school, you can work in the counseling offices. You could lead programs, you could run for office. There's just so many pieces to it.
Yeah, there are. So just at St. Luke's alone, so with ambulatory psychiatry, which is the department that I am clinical lead over, I have 103 psychotherapists.
Wow.
Who work for me. What do? They do things like doing psychotherapy in PCP offices, doing for integrated medicine. They're in specialty offices. We're in 63 schools. So I have LCSWs and LPCs sitting in your child's school to do therapy with them during the school day, so they don't have to worry about parents getting them to a counseling appointment. We're in traditional outpatient offices. We're in partial hospital programs. We are in community-based programs. And really, there's nothing that, if you get the degree in social work or counseling, you're going to have tons of options.
Yeah.
Tons.
So many options in so many different areas. And even now with the virtual pieces that are going on, even though I'm like Amie, I'm a little old school for that, but I've also seen now, because of the pandemic, we are able to provide services to rural communities. Individuals who have social anxiety would have never gone to a therapy office. They're getting help now for the first time in their lives. So there's also the flip side to that. Do I love in-person more? Absolutely. Do I love in-person education more? Absolutely. But for some individuals, the virtual might be the only way they're going to get the help or the education that they need. So I think we do need both. I think we're trying to be more future focused.
Yes.
And that's,
I'm trying, Christina.
I'm trying too. It's hard. We're trying.
Well, you're both doing an excellent job. So I guess the last question that I'll have for you both then is a word that's come up in a lot of different avenues throughout this conversation for obvious reasons, was resources. So for people that maybe are feeling like, okay, this is a future that I could have, this is something for me, this is something I want to learn more about. Certainly positive, informative resources are out there. I'm sure you two have plenty that you could mention. Christina, I'm going to go ahead and start with you. Just any particular resources that you would suggest to people that maybe want to get involved in social work, professional counselors, psychotherapists, psychologists, whoever it may be?
I would say definitely, go talk to some universities, go talk to individuals who are in the field or, in those programs. I oftentimes will talk to students or, projected students who are thinking about the LPC or the LCSW down the road, and go talk to both. Who do you feel that you're going to be able to work with? What programs? Look at the curriculum. What courses do you want to take? So I think it starts there, and then apply, and then go for your interviews. At Marywood, we interview everybody who is going to come into the program. We want to make sure that they're going to be a fit for us, as well as are we going to be a fit for them. Sometimes after meeting with me, they say, you know what, I'm going to go the LPC route. I'm like, great, just go help people,
Right.
because we need you, and vice versa. Sometimes we have students in our program who already have an LPC and they come back for the LCSW or the MSW because they want a different credential, or they want to do community organizing now, and they have a job lined up, but they need the MSW, instead. Whatever it takes, but I think I look at it as an investment. Most of our students come in with a loan. They get a federal loan. Most of them will qualify. And I say, if you didn't have the master's in counseling or in social work, you're not going to be able to make the money that you can make. You're not going to have the variety of jobs. So I do think it pays for itself. I remember paying my loan back. It took a long time. But I'm so thankful that I took that loan and invested in my education, because it's given me so many opportunities to help individuals. There are some scholarships out there. My hope for the future is that there are going to be more partnerships with undergraduate programs as well as graduate programs. I'm hoping like hospitals for sure. Just because of the finances available, if you have an incredible worker, who has an undergraduate degree, can you give them more of a stipend to go get their master's degree?
Right.
And I think that's starting to happen more and more. I know in child welfare agencies, that's starting to happen more. Hospitals are starting to do that more. Some other organizations are doing some of that. But I also think universities then need to create a supportive learning environment. We have to recognize that students are up against a lot. They're working full time, they have family responsibilities, and we're seeing a different student now since the pandemic, because they're also dealing with their own trauma, their own loss, their own issues. So the universities have to be very supportive to students while we're teaching them.
Yeah. Well said.
Well, listen, ladies, this has been a wonderful and informative conversation. So to you, the listener out there, if this is a path that you could see yourself walking down and addressing the shortage of social workers and professional counselors, we hope that this podcast was informative. If you've got someone in your life that you think this could be an excellent path for them, a field for them, certainly be sure to share this podcast. Another great episode here of the Just Start the Conversation podcast. I want to thank Christina Gigler, the Assistant Professor of Practice and Coordinator of the Lehigh Valley Master of Social Work program at Marywood University. Christina, I'm going to speak on behalf of Amie and say, anytime you want to come on back and kick it with us, you feel free to do just that.
Thank you so much. This was a lot of fun.
And for Amie, good to see you again, my friend. It's been an episode or two since we've seen each other. So thank you for all the information as always today.
You're welcome. Good to see you too.
For my friend Amie, Alanson, Dundon, and for Christina Gigler, this is Crockett on the Just Start the Conversation podcast. It is brought to you by St. Luke's University Health Network. Find it on YouTube or wherever you get your podcasts, and get more information at sluhn.org.